Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome back to another episode of Healthy Births, Happy Babies. My name is Dr. Jay Warren. I'm the Family Wellness Chiropractor and the Wellness Care Coordinator here at the CAP Wellness Center. And today we have back with us Kimberly Johnson. She's been on the podcast a number of times. Hopefully you've had a chance to listen to some of her previous episodes. And today we're going to talk about scar tissue and how it may be impeding your postpartum recovery. This is definitely an area that Kimberly is an expert in. Not only is she a body worker, but she's a certified sexological body worker, which meaning that she has a lot of expertise and extra training in scar tissue remediation in the pelvis and helping pelvic floor recovery. But before I jump into our interview, I want to take a moment, as always, to thank our sponsor, the CAP Wellness Center, who makes this podcast possible for us. The CAP Wellness Center in Encinitas, California, has assembled an incredible team of fully certified holistic healthcare professionals that offer the very best in prenatal, postpartum, and pediatric wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. And like I said, Kimberly has been on our show a number of times, but just to remind you of who she is, Kimberly Johnson is a certified sexological bodyworker and a certified somatic experiencing practitioner. She's also a single mom, doula, Rolfer, and yoga teacher. She leads workshops internationally and virtually on the intersection of women's sexuality and spirituality, as well as holistic postpartum healing. After living in Brazil for 8 years, she now resides in San Diego, California, where she is a private practice specializing in birth injury, birth trauma, and sexual healing. So with that, let me switch over to my conversation with Kimberly Johnson. Hi, Kimberly. Welcome back.
Hi, Jay.
How is everything going today?
It's been a really good day so far.
Good. Well, we are very happy to have you back. This is actually your fifth time back on the podcast. For those listeners, you've heard her bio already, but I also wanted to just kind of reference the previous episodes that Kimberly's been on with us. As I said, it's the fifth time. So the previous ones, we've talked about pelvic floor issues in episode 10. Episode 16 was about creating sanctuary plans for your postpartum care, and we talked about healing a prolapse in episode 22, and episode 24 was about saving your sex life after having a baby. And today we're going to talk about scar tissue and how it might be limiting the postpartum recovery. And this is obviously something, Kimberly, you're definitely an expert about. And we want to share as much information with the women listening so they can have an idea of what they might be looking for to be able to get that help. So before we jump into that, though, you have some updates since the last episodes that have been on. You are fully certified right now as a practitioner?
That's right. Since we talked last, I became certified as a Somatic Experiencing practitioner.
Right.
So that training is 3 years, and it's specifically to work with trauma, and trauma just being defined as anything that kind of happens too far, too much, too fast, and our bodies aren't able to fully digest or process, and that leaves a kind of residue that sometimes creates patterns in behavior, patterns in our body, patterns in our relationships. So I'm really excited to be fully certified now and combining that work with the sexological body work, because I find that work and the nervous system tracking skills together with touch is kind of the magic combination.
Right. Well, congratulations on that 3 years of work. That's an incredible process. And you're also in the midst of writing a book. I understand you've completed your first draft.
Yeah, I completed the first draft. It was kind of the big heave-ho, 80,000 words. And as a first-time author, there's a lot of doubt, like, am I actually going to be able to write that many words? And yeah, so I completed it, and I'm really excited about it, and it'll be out probably late next year, 2017.
All right. Well, we'll be looking forward to that. So congratulations on all of that. And let's jump into our topic then today about scar tissue. I know that's something as a practitioner you're working a lot with. And I guess but even before we talking about like how it is limiting recovery, tell us about like what a woman might be experiencing that would indicate that scar tissue is an issue in their postpartum recovery.
That's a great question. So first thing is that scar tissue is something that most medical professionals aren't really looking at. And not even just medical professionals, but even body workers, because scar tissue is made itself of fascia, a very dense connective tissue. And historically, fascia has been something that's just been scraped away as people who are studying anatomy look for structure. And so only in the last 50 or 60 years have people started to understand that the fascia, which is the layer of tissue that basically surrounds everything in the body, that surrounds, our whole arm, and then each muscle group like the biceps and the triceps and the delts, and then each bicep and each tricep. And it's largely creating the shape and determining a lot of the function. So, because it just wasn't given any attention, it's not usually considered a very significant factor in our overall health or in our pelvic health. And what women might experience postpartum, if scar tissue is contributing to something, it could be that they're having pain during sex. So scar tissue can form, we need to distinguish between scars and adhesions. So scars are something, we usually think when we think of a scar, we think of, okay, you had a surgery, that there was a cut, and then you stitch it back up, and the scar is that line. But their adhesions can develop around scars, and scars can follow fascial trajectories. So they can move. So there's something like a passive contained scar and an active scar. In the pelvic floor, it's a relatively small area. And as you know, an episiotomy is when the perineum is cut, the skin between the vagina and the anus. And then many women experience all different kinds of tearing during birth. It could be a perineal tear. It could be something that goes up higher into the vaginal vault. It could be a labial tear. And some of those get stitches and repair, and some of those don't, depending on how severe they are and depending on how they're going to heal. So a woman might feel pain during sex that's related to scar tissue because of the way that all of the muscles are intertwined and interrelated, and that the fascia is also wrapping them. Something that seems very distant can actually be related. So sometimes when I'm doing internal work, I'll push on, so I think of the pelvis like a clock, and say I push on the 5 o'clock point, someone will insist that I'm pushing on the 2 o'clock point. But that only shows me that there's, and people are pretty accustomed to the term like referral pain, but in this case it's actually a direct line and connection between the fascia and the scar tissue. And so as that scar tissue dissolves and softens, then all of those muscles can settle back into their original and best places. Scar tissue can affect prolapses. It can contribute to it. It can cause them also. Scar tissue definitely contributes incontinence. It contributes to diastasis, so the separation of the abdominal wall. It can be a factor in almost every common postpartum pelvic floor symptom.
And so is it correct in saying that even though you might have a scar, that if it's healed properly or worked with, the adhesions are released, that the scar could still be there, but the tissues can be very functional or restore their function?
That's right. That's exactly right. So if the scar is healthfully contained, and how do you get a scar to remain contained? In your biochemistry, you have a good pH balance where it's not an inflammatory environment. So an inflammatory environment is going to encourage adhesions. So that's one thing. Another thing is biomechanics. So, pregnancy is notorious for shifting your lower back position, shifting the way that the pelvic bones relate to each other. And so if the biomechanics aren't right, then that can also contribute to a scar not being as mobile or as healthy as it can be. And then there's just the emotional part. So that's, emotion we can put in the same category as trauma. And scars are physical artifacts of trauma. So a lot of times you can do a lot of body work, but if someone who's doing the body work or the person who's receiving it isn't actually consciously connected to what's happening as it's happening, so the practitioner needs to have those skills to lead that person into that experience, then the scar won't resolve. And by resolved, I mean being contained, not continuing to proliferate unnecessary collagenous connective tissue, but returning to its original function, which is just to heal and, adhere the layers that need to be adhered, but not gather up surrounding tissue and adhesions to help out.
So a scar that a woman might have had, like, say, from an episiotomy or a cesarean, over the years it can continue to, I guess, proliferate, or is it gathering other adhesions and becoming tighter and tighter? It's not just a one time it's healed in a couple of weeks and then it's static?
No. If it's, and the really impressive thing about scar tissue is that it can be very pervasive, and it can cause things like, a uterine prolapse can then grow up and be seen as a dowager's hump, because it will grow along a fascial trajectory if it's not contained. So that's why it's imperative, especially all scar tissue, but especially perineal scar tissue, because as you know, like, the perineum is the center of two of the main meridians in Chinese medicine. It's, the foundation of our energy system, which isn't some woo-woo thing. It's like how we actually mobilize ourselves in the world. It's why so many women feel so ungrounded and so dispersed after having a baby, because literally their pelvic floor is invested with scar tissue, and it's not allowing full sensation and full presence into that area. But with the right manual manipulation and with the right presence and witnessing skills, that scar tissue can dissolve. So that's the good news.
All right.
Is that it's not a life sentence. If you use castor oil, you use heat packs, you use manual pressure, and you're able to move through the emotions that were present at the time the scar tissue was formed, then you can dissolve that scar tissue, and the body will go in, the fibroblasts and macrophages that eat cells that are old and unnecessary will go in and process those and digest them, and then they'll be eliminated.
And, well, it just came to think about, like, as far as the pelvic floor is concerned, like, we're talking kind of postpartum healing, but where would it start? I mean, it would obviously, like, you mentioned about all the lumbar changes that are happening in the pregnancy, so that could set up an altered birth experience or a more difficult birth experience. But then, if it's all in the pelvic floor even before you're born, or not born, but conceived, that could affect, functionality as well. So it's not just birth that would cause things there.
That's right. So I really recommend that women have vaginal mapping sessions with people who know about scar tissue remediation before they get pregnant, because if there is scar tissue from abortions, from LEAP procedures, from colposcopies, sometimes people have pelvic floor scar tissue from inserting dry tampons. Sometimes they have it from rough sex. There can be all different ways that scar tissue forms. And many doctors I've heard lately realizing that cervical scar tissue is hindering people from fully dilating. I have had clients tell me that their doctors were aware of that. and that during birth they're trying to break up scar tissue, which is really pretty painful, especially to be doing that at the same time as the baby's impact, full impact, head impact is coming down onto the cervix. That's something that can be dealt with beforehand and can actually really clear the passageway, because like I said, it's not just physical connective tissue. If a woman has had an abortion, usually that's a fairly significant experience in someone's life that had an emotional component to it, that had, it has a whole story to it, and sometimes the body hasn't totally let that go.
Right. Well, and you said it's important to have a woman to have vaginal mapping done beforehand. What is vaginal mapping?
Yeah. Mapping is a process of internal touch work. So I actually touch a woman's vulva and vagina, and it's giving someone a chance to have a proprioceptive experience, so a felt experience of what their own anatomy is like outside of a sterile medical context and outside of a sexual experience. So it's really just feeling what is your own body. How much sensation do you have? Where do you feel things? Many women, we're not really educated, so a lot of times it's just giving them, like me pressing in one direction and saying, this is scar tissue. Can you feel that? This is the texture of it. Is that what you perceive? Or this is a tight muscle. Do you feel that? Or this is your G-spot. Do you know where it is? This is the size of it. Here's the borders of it. So it's a hands-on education, which is so important before giving birth, because post-birth, so many women are experiencing and feeling so many things, and it gets all conflated. So I've worked on a lot of women who have legitimate birth injuries, but their perception of the injury is much different than what the actual injury is, because it's compounded by anxiety and trauma and stress and pain. And so their body, their brain's pain receptors and kind of coupling with the physical symptom is so tight that it's almost impossible without reprogramming those pain receptors to really heal whatever it is that their presenting symptom, like say it's a prolapse.
And you mentioned the term scar remediation as part of like this healing process. Explain that for our listeners.
Yeah, so scar tissue remediation, which is actually a website, that scartissueremediation.com, that I have with my mentor. The reason I do this work, as I've mentioned in other episodes, is because I had a very severe pelvic floor tear, and I went on a big search to try to figure out how to heal myself non-surgically. I was told I needed a full pelvic floor reconstruction. So scar tissue remediation is the process of working on scar tissues to restore radiant health in the body. So it's, I just actually got back from England, where I taught a group of midwives and doctors and doulas and body workers how to work on scar tissue specifically for women's pelvic health. And actually we're calling it for people with vulvas, because there's transgendered people in the course, and the work is for, we actually had men in the course too, and scar tissue happens in men's pelvic floors as well, and in prostate and everything. But scar tissue remediation is, we're developing awareness and bringing scar tissue to the forefront as something that needs to be looked at. Because what happens is, say somebody just goes, I would say that most physical therapists, pelvic floor physical therapists, know about scar tissue. They're hindered by the model they work in, which is like 30-minute increments. Because to really get deep into someone's nervous system in a way because we're talking about big events for scar tissue, like a cesarean, which is a major abdominal surgery that usually, some people have scheduled them and know that that's what's going to happen and have some mental preparation for it, but that doesn't mean their body's prepared for it. But that's sort of the best case scenario. But then there's people who end up with an emergency C-section when they were expecting something completely different. And all of that memory is in the scar. I recently worked on someone whose last child was born 15 years ago. And we were working on her cesarean scar because it's kind of lumpy, and she had a lot of fat below the cesarean scar above her pubic bone that just felt really unnatural to her and felt really like excess and just didn't feel like part of her body. And as we worked on the two sides of the scar, one of the sides was more inflamed, brighter color. It looked inflamed just any layperson could see that. And as we worked through it, and her body started to have a recall of that moment when she was being stitched and when her baby was being born, the person who was on that side of the table, she had a doctor, one on either side of her, was being very belligerent towards her, and she was having a lot of anger and a lot of frustration, but also a feeling of helplessness because she's in the OR and, she's at the mercy of the people who are operating. That once she was able to, number one, recognize that that's what her body was holding, and number two, be able to say in the present moment what she wasn't able to say then, which is a completion of a fight or flight response. The pain completely dissolved on that side of the scar.
Wow.
And that was an amazing case overall because she was really coming to me thinking we were going to work on the cesarean scar. But a lot of times, if the cesarean scars are active, they'll adhere. So, like, the cervix will get adhered, and then that will cause painful sex because the cervix can't move up and out of the way during orgasm. So then penetration, because it's not mobile, so penetration becomes painful. And so I'll have to work internally. I will have one hand externally and one hand internally to soften the scar and release the cervix, or whatever else in the area is kind of tethered together. So I knew I was going to have to do internal work with her. But then what ended up being revealed is that between our first session and our second session, I didn't even know that she was a smoker. But she came back in the second session and said, I quit smoking. I don't smoke anymore. And I was, shocked because, first of all, I didn't know she was a smoker to begin with. But second of all, it just confirmed an idea or a theory that I have. I don't really believe in willpower. I believe that there are underlying conditions that create behavior. And we can try to change our behavior all we want, but if we don't deal with those underlying conditions, we can't actually change our behavior in a way that's not just overlaying another pattern. And so in her next session, which was an internal session, she had a flashback memory that basically confirmed to her so many other choices in her life that she was so confused about why she had made, that when I just had my finger lightly in the territory, her body retrieved the memory that she needed so that the rest of her life kind of made sense. And during those two sessions, she made just a radical shift in her life about how she wanted to work with boundaries and really feeling her own voice and not caring what other people thought about her. And she had a lot of scar tissue in her pelvic floor from being an addict earlier on in her life and having a lot of really rough unconscious sex.
Now, was she coming to see you for scar tissue remediation for preparing for a VBAC?
No, she's menopausal, and she had just heard about scar tissue remediation, and she knew that her cesarean scar, she still felt numb in her belly. She had this kind of adipose fat tissue that seemed sort of incoherent with the rest of her structure, and so she came in for that.
Wow, that's a whole bigger healing that she received instead of just working on a surface scar. That's an incredible story.
The scar tissue work is really, really profound. I mean, I had another person who had a scar that's not even pelvic related, but she almost lost her hand in a car accident. And to reconstruct her hand, they took part of her pelvic bone, her ilia, to make finger bones out of. And it's been about 20 years since her accident. And as I worked on the scar tissue in her pelvic bone, her hand at one point had been attached to her hip because it was getting irrigated through her femoral artery because she didn't have blood supply to her hand because she barely had a hand while they were reconstructing it. And as I worked on her hip, all she could feel was tingling and flushing through her hand, because the body holds all these memories and is just waiting for an opportunity to have some completion.
So it brings it up to the surface in order to fully experience the moment, integrate it, and then it can let it go.
That's right. And the way that I work is usually it sounds dramatic, but the way that the person experiences it, I do things in a very deliberate and step-by-step way. I find that the process begins when people even call me, because working with sexuality, working with scar tissue, most scar tissue is formed during a traumatic event. Like that's inherently, car accident, scar tissue, appendicitis, an unexpected, ruptured organ. It's unusual that a scar would happen and it just wouldn't have a story with it, or wouldn't have a somatic response. But it's a lot how I feel about birth stories. It's people search around for therapy and ways they want to feel better in their body, and they want to feel better in their life and more empowered. And it's if you want to go to the center of something and get to the core of it, you can go to a birth story. Ask any woman about their birth story, and if you sit with them long enough, you're going to get some really big gems and soul lessons. You can go to scar tissue, because it's just so direct. Your hands are on the territory where the body and the energy field was disrupted. Or you can go to sexuality, because it's just so much at the core of how we express ourselves in the world, and there's so many family and personal and cultural scripts around it that we're all sort of working in the shame field, and we have this opportunity to really do some fundamental level healing when we attend to those areas.
Right. Well, I mean, it's obviously something that a woman listening to this might jump in at first to help with any kind of scar tissue that might have happened after a birth, but there is so much more available. Obviously, tell our listeners in our last couple minutes how they can get in touch with you and learn more.
So I work in Encinitas, California, where you work also, and they can get in touch with me through my website, which is magamama.com, magamama.com. I do have people that fly in from out of town and stay for a weekend, so I can give them a couple of sessions while they're here. My mentor and sort of one of the world's leading specialists in scar tissue is in LA. Her name is Ellen Heed, and her website is ellenheed.com. You can learn more on the scartissueremediation.com website. And I just really encourage women to not ignore their symptoms and to allow themselves to take a bit of a risk or step out of their comfort zone in really insisting that their doctors give them referrals to pelvic floor physical therapy, or they find a sexological bodyworker, or they just simply practice some self-care techniques. So maybe that would be a good place to end, is just, if you've had a cesarean and you feel like there's some numbness around the scar, you feel like it's not, you can't feel between the cesarean scar down into your pelvis, you have aversion to touching the scar, or you don't want your partner to touch the scar, that you start with castor oil packs. So you just get organic castor oil. You get some cotton flannel strips. If you don't have that or you don't know where to get it, you can get it at a fabric store, or you can use sanitary napkins because they'll absorb the castor oil, but it'll still saturate, organic cotton, of course. And then put that over the scar, and then put a hot water bottle over that, not scalding hot water though, like warm water, and do that for as many days as possible for about 20 days. And then after you take the hot water bottle off each day, just massage the scar. And if massaging is too much, then you just start by physically touching it. But just leading yourself through a process of reassociation to that area.
Well, thank you for that advice. And I know, all the websites you just mentioned has tons and tons more information for any of our listeners that are in Southern California to be able to take some next steps and take better care of them. And I also encourage you listeners to go back and search on our website for Kimberly's previous episodes as well, because obviously just from this conversation, she has a wealth of knowledge, and she shared some of that in our previous episodes. And Kimberly, I'd love to have you back to dive into this more.
Thanks so much, Jay. It's always great talking with you.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.